practice session with MiTio. Welcome. Before the class begins, as usual, let me go over some reminders. You must arrive on time, stay the full hour, and participate. To receive a credit, please make sure you're muted until I call your name, and there is no need to enable your camera. The password for your attendance link will be given at the end of the session. Please do not send chat messages with questions about the password. Try and make sure that your name and last name here on Kajabi are spelled exactly as you're registered, so we can keep track of attendance correctly. If possible, also put your target language next to your name. And don't forget to report your attendance. The links I provided in the chat box. There is also a link with the video explaining how to report your attendance. And like I said, please do not try that link.
Give you a
Turn it off because it is now
of
showing on everybody else's screen. Don't press any links until our session is over. If you're a first-time student, you can observe today to see what to expect from the sessions. If you're going to be an observer, for now, let's do this. Those who are going to observe, just use the hand up sign so I can count how many are actually participating to allocate enough time for every participant. Please have your dictionary open and try to use medical interpreter protocol. This is when you refer to yourself in the third person when requesting repetition, clarification, verification, or a moment to look up a term. Please practice note-taking during this hour. That way you can take advantage of the full hour. And do not forget to write down any new terminology that appears not only on the segment that you are interpreting, but when others interpret as well. And make sure you check it right when you hear it, so you do not waste time looking for the term if it appears in your segment to interpret. We recommend that you practice daily by yourself. Don't just rely on these sessions only. We recommend WebMD and Medline Plus as resources for your individual practice, but if you know of any good resources that you find helpful, please let us know. We will appreciate any additional material. Peer assessment is what we do in our chat box. This is when you can help each other with terminology or comment on each other's performance if you speak one another's target language. Also, please don't forget to compliment each other as well. Reminding you of the availability of coaching sessions one-on-one. They're available for those who do not have enough live sessions for whatever reason. And also you can just have additional practice with the coaches of your choice, and the link to book those one-on-one sessions is also provided in the chat box. That seems to be it, and we're ready to begin. I think I took everybody's name. If not, I will definitely ask you once I run out of my roster to make sure that I didn't miss anyone. Okay, so the first one to sign in was Amanjoti.
Hello, good evening.
Good evening. Okay, let me, I was trying to type our topic, but it's in the wrong language for me. Okay, bone. Okay, so our first topic is bone marrow okay. I misspelled it. Biopsy. Let's start. Bone marrow is the soft tissue inside your bone where blood cells are made.
Bone marrow एक सॉफ्ट टिश्यू है जो आपके खून का उत्पादन करता है.
During a bone marrow biopsy, a small tissue sample is taken and send for tests.
बोन मैरो के दौरान बायोप्सी के दौरान आपका बोन मैरो का सैंपल लिया जाता है जो निरीक्षण के लिए भेजा जाता है.
Quick question. In your native language, there is no native terminology for bone marrow. You use English term? Do you have a dictionary?
It says it's asthit mazza, but it's like we don't really speak these kind of words in general terms.
But if you talk to the patient, will they understand what you're saying if you say bone marrow?
Yeah, but if I say this word, I've never heard of this myself either.
Okay. Okay, let's continue. The biopsy is often taken from your hip bone in your lower back.
बोन मैरो हमेशा आपके कमर के जगह से ली जाती है.
I see people complaining about echo. I lowered my volume, and I think there is no echo right now because I heard it too, but I thought it was not coming from my end. Okay, let's continue. A bone marrow biopsy is done to check for blood diseases.
Interpreter needs a repetition. I didn't hear you well.
Sure. A bone marrow biopsy is done to check for blood diseases.
Bone marrow biopsy खून में जीवाणुओं की निरीक्षण करने के लिए की जाती है.
Check for blood or bone cancer.
खून या हड्डी के कैंसर के लिए निरीक्षण किया जाता है.
See how treatment is working.
देखने के लिए कि इलाज कैसा चल रहा है.
Check for infection.
इन्फेक्शन के लिए निरीक्षण करने के लिए भी किया जाता है.
The test takes about 30 minutes, so plan to be here about 1 to 2 hours.
ये निरीक्षण आधे घंटे का होता है, सो आप कृपया करके 1 या 2 घंटे जल्दी आने की कोशिश करें.
Before the test, the staff may ask you about your medicines, including prescriptions and over-the-counter medicines.
निरीक्षण के पहले जो स्टाफ है वो आपकी दवाइयों के बारे में पूछताछ करेंगे.
Okay, thank you. Very good.
Thank you so much.
Next is Edwin.
Good evening. Can you hear me okay?
Yes, I can hear you perfectly. And as you can see, the echo is gone. So I knew it was not coming from it was my voice, but it wasn't from my side. Okay. So we continue with bone marrow. The staff may ask you about allergies, such as to medicines, foods, or latex.
Bueno, y también el personal puede requerir un historial y preguntarles sobre algunos medicamentos, alergias a medicamentos, a comidas o a látex.
Also about other health conditions and past surgeries.
También algunas condiciones de salud del pasado y si tuvo alguna cirugía anterior.
If you're pregnant or think you may be pregnant, tell the staff before the test.
Bueno, y si está embarazada o tal vez piensa que lo está, por favor, hágale saber al personal.
During the test, you will wear a hospital gown.
Y durante la prueba tendrá que tener la batilla del hospital puesta.
You may be given a sedative or pain medicine.
Tal vez se le tenga que dar algunos sedativos o algún medicamento contra el dolor.
You lie on your side or on your stomach, and the doctor injects the site with numbing medicine.
This is the interpreter speaking. May you please repeat the whole statement?
Sure. The doctor injects the site with numbing medicine. You lie on your side or on your stomach.
Bueno, por favor, recuéstese de lado o en su estómago abajo y el doctor le inyectará un medicamento adormecedor.
When the site is numb, the doctor puts a needle through the skin into the bone.
Y cuando la parte ya esté adormecida, el doctor le aplicará esta jeringa hasta dentro de su hueso.
You will feel some pressure and may feel some pain. This often lasts only a few seconds.
Bueno, y tal vez sienta alguna presión, algún dolor, y esto solo puede durar algunos segundos.
The doctor will remove a small tissue sample and the needle is taken out.
Y el doctor tomará la muestra de tejido. This is the interpreter speaking. May you repeat the last part of the statement?
And the needle is taken out.
Y la jeringa se le removerá.
A bandage is put on the site.
Y un tipo de vendaje se le pondrá en el sitio.
Okay, very good. Thank you.
Thank you.
Rahlia? Rahlia Zakirova? Okay. Maria Walls?
Yes.
Yes,
Here.
good evening.
Good evening.
Good evening. Let's continue. After the test, you will need to lie on your back for 15 to 20 minutes.
Después del examen tiene que estar acostado de espalda por 15 a 20 minutos.
The nurse will check the bandage for any signs of bleeding.
La enfermera va a examinar el curita por cualquier señal de sangrado.
You may have some bruising or mild discomfort.
Quizás va a tener un poco de ampolla o un poquito no va a estar cómodo.
You can remove the bandage the day after your biopsy.
Puede removerse el curita un día después de su biopsia.
The results are sent to your doctor, and your doctor will share the results with you.
Los resultados son enviados a su doctor y el doctor compartirá los hallazgos con usted.
Call your doctor right away if you have pain going down your leg.
Llame a su doctor inmediatamente si tiene dolor que va hacia abajo de su pierna.
If you're bleeding where the biopsy was taken.
Si está sangrando donde se tomó la muestra de la biopsia.
If you have fever over 100.4 degrees Fahrenheit or 38 degrees Celsius.
O también si tiene una fiebre más arriba de 100.5 en Fahrenheit o 38 de Celsius.
Okay, switching topics. The next topic is cancer. Cancer is caused by abnormal cells that grow quickly.
El cáncer es causado por células abnormales que crecen rápidamente.
It is normal for your body to replace old cells with new ones, but cancer cells grow too fast.
Es normal para el cuerpo reemplazar células viejas con nuevas, pero las células cancerosas crecen muy rápido.
Some cancer cells may form growths called tumors.
Algunas células cancerosas crecen y eso se llaman tumores.
All tumors increase in size, but some tumors grow quickly, others slowly.
Todas las células cancerosas aumentan en tamaño, pero algunas crecen rápido y otras son más despacias.
Sometimes tumors are not cancers, and they are called benign.
A veces algunos tumores no son cancerosos y se llaman benignos.
They're made up of cells like those of healthy tissue.
Y esos son hechos de células de tejidos sanos.
This kind of tumor stays in one area and does not spread to healthy tissues or organs.
Y este tumor se queda en un área y no se esparce en otros tejidos o órganos.
Cancer tumors are also called malignant tumors.
Los tumores cancerosos también se llaman tumores malignosos.
Cancer from these tumors spread through blood and lymph systems to other parts of the body.
Cánceres así se esparcen en la sangre y en el sistema linfático y en otras partes del cuerpo.
Okay, very good. Thank you. Quick notice. I guess you're taking notes typing on your computer.
Yes.
Yeah, this is very audible.
I see.
Yeah,
okay. I'll do it on my pencil.
when you hit the keyboard, it's very audible, and I will have to say loud enough to be disrupting. I'm fine, but I don't know, depending on where you work, if they allow to take notes on the computer, you will have to be cognizant about the sound, because microphones are pretty sensitive. They pick up every noise. Unfortunately, some of them actually amplify the noise more than they amplify the voice, and it can be a problem for you.
I appreciate.
I know it's a really great tool, because even if you type, even if you do typo, you still can read the letter. It's much more helpful than handwriting, for sure. But just be cognizant of how loud you hit the keyboard.
I appreciate that. I was taking it for this, but I will definitely take pencil notes.
It's fine for practice, but I'm just telling you for the future.
Yeah,
and again, some companies may not allow it. I hear that it's, it depends.
Thank you so much.
Sure. So why I'm also saying, I know very well how much better it is to take notes on the computer, but if it's not allowed, and also for your CMI, if you go for your exam, you will not be allowed to take notes on the computer. And if you don't have at least some of the skill to take notes with your hand, it's going to be very difficult for you to pass the exam.
Thank you so much for the advice. I really appreciate that.
Okay, sure. Okay, it was very good performance, though.
Thank you.
Okay, next is Luis.
Hello.
Hello. Let's continue with cancer.
Sure.
Now I have echo again. You know what it might be, Luis? Try to lower your volume.
My volume? Okay.
Because I think that's what makes the echo. Not really.
Do you still hear echo?
I do. Can you hear? No, I think it's gone. No, it's not.
I don't hear anything.
Okay, let's go. There's not much we can do about it, I guess. Okay, so when cancer spreads, it is called metastasis.
Cuando el cáncer se esparce, se llama. Interpreter needs to look up a word.
Sure. Everyone, if you don't know how to say metastasis in your target language, please check it as well.
Can you type it in the chat for me, please?
It's kind of started metastasis. It actually, just like it sounds, metastasis. There's no
metastasis.
Yeah. In Russian, it also has a different. It's metastasis rather than metastasis. Yeah, so it's a different syllable that's more pronounced. Okay, cancer cells travel through the blood or lymph system from the tumor.
Las células cancerosas viajan por medio de las células y el sistema linfático.
It is called the primary site.
Se llama el sitio primario.
There are many kinds of cancers.
Hay muchas clases de cáncer.
Carcinoma is the most common type of cancer.
La carcinoma es la clase más común de cáncer.
Lung, colon, breast, and ovarian cancers are often this type of cancer.
También de los pulmones, de las mamas y también Japanese repetition.
Lung, colon, breast, and ovarian cancers are often these type of cancer.
De los pulmones, el colon, de las mamas y también cánceres en los ovarios.
Sarcoma is found in bone, cartilage, fat, and muscle.
La sarcoma se encuentra en los huesos, cartílagos y músculos.
Lymphoma begins in the lymph nodes of the body's immune system.
La linfoma empieza en el sistema linfático de la nariz.
They include Hodgkin's and non-Hodgkin's lymphomas.
Ellos incluyen linfomas de Hodgkins y de no Hodgkins.
Leukemia starts in the blood cells that grow in the bone marrow.
La leucemia empieza se empieza a desarrollar en la médula ósea.
And they're found in large numbers in the bloodstream.
Y se encuentra en muchas variables del fluido de la sangre.
Okay, thank you. Very good.
Thank you.
Going back to Rocklia. Are you with us? Rocklia, are you participating or just observing? Okay, moving on. Audrey?
Hi, good evening.
Yes, good evening. Let's continue with cancer. Signs of cancer depend on the type and location of the tumor.
Los signos del cáncer dependen del tipo de cáncer y también el lugar del sitio.
With some cancers, there may not be any signs until the tumor is large.
Con algunos tipos de cáncer no hay síntomas antes que el tumor crece a un buen tamaño.
Common signs include feeling very tired, weight loss that occurs without knowing why.
Los síntomas comunes son los cansados y también la pérdida de peso inexplicable.
Fever, chills, or night sweats.
La fiebre y también las calambres son muy comunes.
Lack of hunger, physical discomfort or pain.
La incomodidad física y también la pérdida de apetito son comunes también.
Coughing, shortness of breath or chest pain.
El dolor de pecho, la tos y también la falta de aliento.
Diarrhea, constipation, or blood in the stool.
La diarrea o la empujación y también el sangrado en la heces son síntomas también.
When cancer is found, tests will be done to see if the cancer has spread to other parts of your body.
Cuando se descubre el cáncer, hay algunas pruebas que van a hacer para verificar si el cáncer está en otros lugares del cuerpo.
Scans, X-rays, and blood tests may be needed.
Las pruebas de sangre y las radiografías también pueden ser necesarias para chequear el cuerpo.
Your doctor will decide what care is needed based on the type of cancer.
El médico va a diagnosticar y verificar un plan de cuidado debido al tipo de cáncer.
How fast the cancer is growing.
¿Cuánto tiempo dura para el cáncer de crecer?
Whether the cancer has spread to other parts of your body.
Si el cáncer viajará a otras partes del cuerpo.
Your age and overall health.
Su edad y también la salud en general.
The most common cancer treatments are surgery to remove the tumor and nearby tissue.
Los tratamientos más comunes son la cirugía para remover el tumor y también los tejidos cancerosos.
Okay, thank you.
Thank you.
Next is, just a second. Vitor?
Hello.
Yes, good evening.
Good evening.
Switching to EPS. That stands for electrophysiology study.
Maybe can I just search for the word?
Sure, and I put it in the chat for you. The term EPS, electrophysiology study, should be pretty close in your language. Let me know when you're done, when you're ready. Everyone, look it up in your target language as well, please.
Yeah. Okay.
Ready? Okay. EPS is a test that checks the electrical system of your heart.
O estudo de eletrofisiologia é um teste que testa a eletricidade do seu coração.
It is done to find why you're feeling faint or dizzy or having irregular or fast heartbeats.
É feito para achar as condições pelo qual você está tonto ou desmaiando e encontrar condições do seu coração.
An adult family member or friend needs to come with you to take you home after the test.
Um parente adulto ou amigo tem que vir com você para te mandar de volta do teste.
It is not safe for you to drive or leave alone.
Não é seguro para você dirigir ou sair sozinho.
Arrive on time for your test. The test takes 1 to 4 hours.
Chegue a tempo para seu teste. O teste pode chegar de 1 a 4 horas.
To prepare for the test, do not eat or drink anything, including water, after midnight before your test.
Para se preparar para o teste, não coma ou beba nada, nem água depois da meia-noite do dia do seu teste.
Ask your doctor if you should take your medicines the morning of your test.
Pergunte ao seu doutor se você deve tomar os medicamentos na manhã do seu teste.
If that's the case, take it with sips of water only.
Se esse for o caso, tome o medicamento com pequenos... interpreter needs to look a word.
Sure.
Pequenos goles de água.
During the test, you will wear a hospital gown and lie on an X-ray table.
Durante o teste, você vai vestir bata médica e deitar-se na mesa do hospital.
An IV is put in a vein in your arm.
Um intravenoso vai ser colocado na sua veia no seu braço.
You're awake during the test, but you may be given a medicine in your IV to help you relax.
Você vai estar acordado durante o seu teste, mas você pode receber um medicamento para te fazer... interpretation of the last part.
You will be given medicine in your IV to help you relax.
Você vai dar um medicamento no seu intravenoso para te ajudar a relaxar.
Okay, very good. Thank you.
Thank you.
Fabiola?
Hello.
Yes, good evening. Let's continue. Small pads are put on your back, chest, and legs to check your heart.
Interpreter needs to look up a word.
Sure.
Unos discos van a estar posicionados en su pecho, piernas y corazón.
For men, chest hair may need to be clipped.
Pelo en el pecho posiblemente necesitará ser cortado.
A blood pressure cuff is put on your arm.
Sorry, interpreter needs to look forward.
It's the most simple ones that become difficult, right? Are you looking for the cuff?
Yeah.
I know.
And then earlier I was looking for pants.
Yep.
Okay. Could you repeat, please?
Sure. A blood pressure cuff is put on your arm.
Y un manguito para la presión va a estar posicionado en su brazo.
Your blood pressure and heart rate are checked during the test.
La presión de su sangre va a estar I'm interpreting the repetition after blood pressure.
Your blood pressure and heart rate are checked during the test.
Y el palpito de su corazón va a estar examinado.
You're covered with a sheet and your gown is removed.
Va a estar cubierto con una sábana y su bata va a ser removida.
Either your groin or your arm will be cleaned. Your groin may be shaved if used.
Interpreter's looking up a word.
Mm-hmm.
Su brazo y su ingle van a estar, los van a limpiar. Sorry, interpreter needs repetition.
Either your groin or your arm will be cleaned. Your groin may be shaved if used.
You said your groin may be shaved or fused?
If used. If they choose to use your groin, they will have to shave it.
Y si eligen usar su ingle, lo van a rasurar.
The doctor numbs your groin or arm. This stings for a few seconds.
El doctor va a adormecer su ingle o brazo y esto va a doler por un tiempo corto.
After this, you should only feel pressure and no pain.
Después de esto solamente va a sentir presión, pero no va a sentir dolor.
Okay, thank you.
Thank you.
Mm-hmm. Shumei?
Hi, Tabian.
Good evening. Continuing with our test here. Okay, you okay?
Yes, can you hear me clearly?
Yes, it's just your sound is very loud. There's some background.
Oh, too loud?
It's a background noise. Yeah. Okay. You may feel skipped heartbeats or fluttering. This is normal.
你也许会觉得你的心跳有点错过，或者是说震动的厉害。
If you feel any pain or discomfort during the test, tell your doctor.
你如果有觉得会痛或不舒服，那告诉你的医生。
Your heartbeat and your blood pressure are measured by the wires.
你的心跳跟你的血压会透过这个电线来测量。
During the test, the table may be moved so your head is up.
在做测试的时候，你这个桌子可能会升高一点，然后让你的头有点高一些。
You may be asked to hold your breath and push as if you're having a bowel movement.
你在做测试的时候，你也许会要求说，屏住你的呼吸，或者是用力，就好像你在排便一样。
You may be given medicines.
你也许会给一些药。
The tube and wires are then removed.
那个管子跟线会把它除掉。
Pressure is put over the site for 5 to 15 minutes to stop bleeding.
它会放一些压力在上面，给5到10分钟。Interpreter needs repetition.
Pressure is put over the site for 5 to 15 minutes to stop bleeding.
我们会在那个测试的地方施点压力，让它停止流血，差不多5到15分钟。
A bandage is put over the site.
OK 棒会放在那个测试的地方。
The doctor will talk to you about your test results.
医生会跟你谈一下你的测试结果。
If the groin site was used for the test, you will need to lie flat in bed for the next 6 hours with your leg straight.
如果它是用腹股沟那个地方做测试的话，你必须要平躺6个小时，然后你的脚要伸直。
During this time, you must use a bedpan or urinal instead of getting up to go to the toilet.
在这段时间呢，你必须要用便盆排尿，你没办法站起来。
Okay, thank you. Tabassum?
Yes, hi, good evening.
Good evening. Let's switch to dementia.
Okay.
Just a second, let me open it up.
Mhm.
Okay. Dementia is a loss of thinking, remembering, language, judgment, and reasoning skills.
Okay. डिमेंशिया जो है वो आपकी सोचने समझने की, बोलने की, याद रखने की और चीज़ों को के बारे में फैसला करने की सलाहियत को मुतासर करता है।
Which is severe enough to affect daily activities such as eating, bathing, and getting dressed.
जिससे आपकी रोज़मर्रा की मामूलात जैसा कि खाना-पीना, नहाना और कपड़े पहनना जैसे मामूलात मुतासिर हो सकते हैं।
People with dementia may have a change in their personality.
जिन लोगों को डिमेंशिया की बीमारी होती है उनकी शख्सियत में तब्दीली आ जाती है।
They may find it hard to control emotions or lose their ability to solve problems.
उनके लिए अपने जज़्बात पे काबू रखना और मसाइल को हल करना मुश्किल हो जाता है।
Although it is normal to need more time to remember things as we age,
अगरचे जैसे हमारी उम्र बढ़ती है उसके साथ चीज़ों को याद रखना ज़्यादा अरसे के लिए वैसे भी मुश्किल होता जाता है।
other thinking and reasoning skills should not change.
Interpreter needs repetition. I couldn't like understand the beginning part.
Other thinking and reasoning skills should not change.
लेकिन दूसरी सोचने समझने की सलाहियत और लेकिन दीगर सोचने समझने की सलाहियत मुतासिर नहीं होनी चाहिए।
Dementia is not a normal part of the aging process.
डिमेंशिया जो है वो उम्र के बढ़ने का एक नॉर्मल हिस्सा नहीं है।
There are different causes of dementia. Some can be treated and some cannot.
डिमेंशिया की मुख्तलिफ वजूहात हैं, इसमें से कुछ जो हैं वो काबिल इलाज हैं और कुछ नहीं।
This is why it is important to have a medical exam to learn the cause of the changes.
यही वजह है कि एक तिब्बी मुआयना ज़रूरी है। एक तिब्बी मुआयना ज़रूरी है तब्दीली की वजह जानने के लिए।
Okay, thank you.
Thank you.
Phoebe?
Hi.
Good evening.
Good evening.
So we're now going on to see what common causes of dementia are.
Okay.
Alzheimer's disease is the most common cause of dementia.
La enfermedad Alzheimer's es la causa más común de demencia.
The symptoms start slowly and become worse over time.
Los síntomas empiezan lentamente y se empeoran como van el tiempo.
Damage to the brain may begin 10 or more years before symptoms appear.
El daño al cerebro tal vez empieza 10 años antes de síntomas se aparecen.
During this first stage, abnormal clumps of protein called amyloid plaques and tangled bundles fibers called neurofibrillary tangles are formed. Okay, that's a loaded sentence. Let me chop it up for you. Okay, let me first give you some facts. So amyloid plaques and neurofibrillary tangles.
Okay. Amyloid.
Fibrillary tangles. Okay, so let's go ahead and check those terms, but let me read the first part of this sentence.
Okay.
During this first stage, abnormal clumps of proteins called amyloid plaques.
Durante esta primera etapa, células abnormales que se llaman placas amiloides
and tangled bundles of fibers called neurofibrillary tangles are formed.
Interpreters looking up the second word.
Probably be somewhere very close. Neurofibrillary, yeah.
Entonces,
fibras,
fibras enredados que se llama óvulos neurofibrilares.
Okay, good. Nerve cells in the brain can no longer connect with each other and stop working as they should.
Las células nerviosas no pueden comunicar uno con el otro y dejan de funcionar como deben.
During the second stage, these symptoms occur.
Durante la segunda etapa se aparecen estos síntomas.
Memory loss, confusion about time and space.
Pérdida de memoria, confusión de tiempo y espacio.
Poor decision making and changes to language.
Pérdida de la habilidad de hacer decisiones buenas y interpreter needs repetition on the last one.
It's okay. We will move on to the next
student.
Thank you. Your time is up, but it was good. Good job.
Thank you.
Yeah, it's okay when there is a lot of terminology. It's absolutely fine to even announce to the provider that you need to check the term.
Thank you.
Because if those don't come across, often enough for you to have it in immediate access, in your brain, it's absolutely fine to check the term. Okay. Bella. Bella? No? Okay. Florence?
Hello.
Do we have Florence?
Yes. Okay.
Yes, I can see you. Okay. Let's continue. So we're talking about symptoms that occur. The damage that occurred during the first stage are now causing the nerve cells to die and brain tissue to shrink.
Ibimenyetso bigaragaza iyo umuntu afite ubwo burwayi tangira kwibagirwa kandi ubwonko bukajya bukore neza bikaba byamuviramo urupfu.
The part of the brain called the hippocampus, where memories are formed, is affected.
Icyo gihe ibice bimwe bigize ubwonko biba byatangiye kwangirika.
The final stage is known as Alzheimer's dementia.
Igice cya nyuma cy'ubwo burwayi ni uko kwibagirwa no kubura ubwenge burundu.
The person loses their ability to communicate and they will need total care.
uwo muntu atangira kwibagirwa no kutagira ikintu na kimwe akora, aba akeneye umuntu umufasha amasaha yose.
As with all kinds of dementia, this disease will progress at different rates for different people.
Ubwo burwayi buterwa n'ubw'umuntu n'abantu batandukanye, ntabwo bafata kimwe.
It also depends on the person's age when they are diagnosed and other health problems they may have.
Kandi nanone bigaterwa n'imyaka umuntu agezemo, bitewe n'ikibazo yigeze kugira mu buzima cyangwa nimba asanga ubundi burwayi butandukanye.
A person with Alzheimer's disease might live for 3 to 4 more years if the diagnosis was made after the age of 80.
Ubwo burwayi bukunda kumarana umuntu imyaka 3 cyangwa 4 hagati y'itanu bitewe n'imyaka afite, cyane cyane iyo ari umusaza cyangwa umukecuru arengeje imyaka 80.
They may live 10 or more years longer if they were diagnosed at a younger age.
Ashobora kubaho imyaka myinshi iyo ubwo burwayi bumufashe akiri mutoya.
No one knows what causes Alzheimer's disease.
Nta muntu uzi igiterwa ubwo burwayi bufata ubwonko.
It cannot be cured and will not go away.
Bushobora kuba uburwayi bwo kugumana butazagira aho bujya.
The treatment may only help to manage symptoms and slow the disease.
Imiti no ubuvuzi ahabwa bishobora kumufasha kubana n'ubwo burwayi, ariko ntabwo byakuraho uburwayi.
Okay, thank you. Just once again, trying Arachlia. Okay, I guess I will count you as an observer. Irene?
Yes, I'm here.
Okay, we are switching to diabetes.
Okay.
Diabetes is a disease in which your body cannot properly use the food you eat for energy.
당뇨는 당신이 먹는 음식을 에너지로 변환하지 못하는 질병입니다.
Your cells need energy to live and grow.
세포는 자라기 위한 에너지를 필요로 합니다.
When you eat, food breaks down into a form of energy called glucose.
당신이 무언가를 먹을 때 글루코스라고 불리는 당이라고 하는 에너지로 바뀌게 됩니다.
Glucose is another word for sugar.
혈당은 다른 말로 설탕, 슈거라고 불립니다.
The glucose goes into your blood and your blood sugar rises.
혈당이 피로 들어가서 interpreter need repetition for the last part.
And your blood sugar rises, goes up.
그래서 혈당이 올라가게 됩니다.
Insulin is a hormone made by your pancreas.
인슐린은 췌장에서 만들어지는 insulin. Interpreter need repetition in the middle part.
Insulin is a hormone made by your pancreas.
인슐린은 췌장에서 만들어지는 호르몬입니다.
It helps glucose move from your blood into your cells so your body can use it for energy.
Interpreter need repetition.
Sure. It helps glucose move from your blood into your cells.
그것은 당을 당을 피로 움직여서 the last part please.
So your body can use it for energy.
당신의 몸이 그것을 에너지로 쓰게 됩니다.
People cannot live without insulin.
사람들은 인슐린 없이 살아갈 수 없습니다.
Okay, thank you.
Okay.
Thank you.
Thank you.
Mm-hmm. Kwan? Do we have Kwan Liu? Okay. Kamikaze?
Yes.
What time did you sign in?
06:04.
Are you sure?
Yeah.
Okay. Let's continue with our diabetes.
Mm-hmm.
There are two types of diabetes. With type 1 diabetes, the pancreas makes no insulin.
Hari ubwoko bubiri bwa diyabete. Ubwoko bwa mbere. Can you repeat the last one?
The pancreas makes no insulin.
Ubwoko bwa mbere ni diyabete udakoresha urushinge rwitwa insulin.
With type 2 diabetes, the more common type, the pancreas does not make enough insulin.
Iya kabiri nayo ntago ukoresha insulin ikwiye.
Or your body is not able to use the insulin the pancreas makes.
Iyo umubiri wawe udashoboye gukoresha urwo rushinge rwitwa insulin, amara yawe arakora.
Without enough insulin, the glucose stays in your blood.
Mu gihe urwo rushinge rwitwa insulin rudakoze, igituntu kirakomeza muri wowe.
There is also diabetes during pregnancy called gestational diabetes.
Hariho iyindi diyabete iza mu gihe utwite.
The mother is not able to make enough insulin to cover the needs of both mother and baby.
Abamama ntibashobora gukoresha iyo insulin uko bikwiye kubw'ubwoba bw'umwana.
With pre-diabetes, your glucose is higher than normal, but not high enough to be called diabetes.
Muri ico gihe diyabete yawe ishobora kurenga gusumba igituntu muri ico gihe.
Pre-diabetes raises your risk for type 2 diabetes, heart disease, and stroke.
Muri ico gihe diyabete yawe ishobora gukomera. Can you repeat the last one?
Heart disease and stroke.
Ukagira umutima hamwe no kuraba.
The good news is that type 2 diabetes can be prevented or delayed with lifestyle changes.
Inkuru nziza nuko diyabete ishobora kubigwanya uko ari bibiri.
Such as losing weight, eating healthy food, or being active.
Bigufasha gutakaza ibiro, gufungura neza. Muri ico gihe biragufasha.
Okay, thank you.
You're welcome.
I am missing one person in my roster. Whose name did I not call? Did I miss anyone? I have 17. We have 18 in the class. Evelyn? Is it Evelyn?
Yes, it's Evelyn.
Okay.
Yeah.
And Serge. Okay. Okay. So let's go with Evelyn for now.
Okay.
Just a second. I need to write down your name so I don't. Okay. So let's continue with diabetes. Over time, having too much glucose in your blood can cause serious problems.
Con el tiempo, tener mucha glucosa en la sangre puede llevar a problemas serios.
It can damage your eyes, kidneys, heart, and nerves.
Puede dañar sus ojos, sus riñones, su corazón y sus nervios.
Diabetes can also cause heart disease, stroke, poor circulation, and wounds that do not heal.
También puede producir problemas, enfermedades al corazón, derrames, circulación, una pobre circulación y heridas que no sanan con rapidez.
When untreated and uncontrolled, these wounds could progress to limb loss.
Cuando no son tratados o están fuera de control, pueden progresar a pérdida de extremidades.
Everyone responds differently to diabetes.
Cada persona responde diferente a la diabetes.
Some of the common warning signs are having to go to the bathroom often to pass urine.
Uno de los síntomas más comunes o interpreter needs to look up for warning signs. Síntomas de advertencia puede ser ir al baño frecuentemente para orinar.
Feeling thirsty even though you're drinking fluids.
Sentirse con mucha sed a pesar de que está tomando fluidos.
Losing weight, blurry vision.
Perder peso, visión borrosa.
Healing is slow for cuts or scrapes on your skin.
Sanarse de una cortada o scrape o una raspada puede ser más despacio.
Feeling tired, hungry, or being irritable and grumpy.
Sentirse cansado o con hambre, irritado o mal geniado.
Okay, thank you.
Thank
Very
you.
good. And Serge?
Yes.
Yes, let's switch to kidney failure. I can barely hear you. Any chance you can increase your volume a little bit?
Okay.
Okay. Let's go. Your kidneys have an important job.
Impyiko zawe zifite umumaro ukomeye.
They remove wastes and extra fluid from the blood in your body.
Ziyungurura imyanda ndetse n'amazi menshi ashobora kuba adakenewe mu mubiri.
This waste and extra fluid is removed from your body through your urine.
Iyo myanda ndetse n'amafluide cyangwa amazi menshi akurwamo akajya mu nkari.
If your kidneys are not working as they should, or the waste builds up in your body, it can make you sick.
Iyo myanda cyangwa ayo mazi atari kuva mu mpyiko zawe impyiko zishobora kugira ikibazo.
This can also be called kidney failure.
Ibi bishobora kwitwa ngo ni indwara impyiko ntago zikora neza.
With kidney failure, the kidneys cannot get rid of the body's extra fluid and waste.
Iyo umuntu afite ubwo burwayi bwitwa bwo guhagarara gukora kw'impyiko, ntabwo impyiko ziba zikiyungurura iyo nkari cyangwa ayo mazi menshi ari mu mubiri.
This can happen because of disease or damage from an injury.
Ibyo bishobora kubaho mu gihe byatewe n'uburwayi cyangwa impyiko zikagira ikindi kizihungabanya.
The kidneys get rid of excess water and waste products. The kidneys get rid of excess water and waste products.
Impyiko ziba zifite imyanda myinshi ndetse n'amazi ayirimo.
They adjust the fluid and chemicals needed by the body.
Amazi cyangwa ibindi binyobwa byose bikozwe n'ibinyabutabire biba bigize ibintu biza mu mpyiko.
Okay, thank you. So I think I called everybody's name. Is that right? Did I miss anyone? Okay, so our password, the proof of attendance, is going to be EPS, the topic that we had that stands for electrophysiology study. EPS will be enough. Let's just do EPS as an abbreviation. Any questions?